Hi everyone, welcome back. Today I am going to be talking to you about meniscal tears, which I see quite a lot in practice. Probably one of the more common knee injuries. So I'm going to be explaining the anatomy behind these tears, what causes them, who is at risk, and really what you can do about it and how massage can help. So firstly, I'm going to talk a little bit about the anatomy of the knee and sort of where exactly the meniscus are. So if you look, it's not the best picture in the world, but if you look on this diagram here, so you see we've got the femur, which is the thigh bone, and then the tibia of the lower leg and the fibula. You've got obviously your quad muscles coming up here. And then if you look very carefully in between, obviously you've got ligaments and things, and the kneecap. And then in between you've got on either side like these sort of discs, which sit in the middle of that hinge joint. Basically these are the meniscus, which are like cartilage discs. So as we said, the femur, tibia and the patella, which is the kneecap, are held together by numerous ligaments forming a hinge joint, and the sort of articular capsule of the knee is held together by these ligaments and also tendons. So as we've just seen on the diagram, the knee has two menisci, or sort of fibrous cartilage, which sits between those bones and basically have a few functions. So its main function is it cushions the joint between the femur and the tibia, absorbing any impact on the knee when you're doing exercise, for example. They help to stabilise the knee and accommodate smooth movement, in daily, just daily walking, normal activities. Because they basically stop those two bones from kind of bashing against each other. The menisci also help to regulate the flow of synovial fluid, which also helps to cushion the joint, and so in that sense they help to protect the knee from general wear and tear, and especially if you're doing a lot of regular exercise that puts a lot of stress through the knee joint. They will also help to balance out the weight distribution of the knee. And again, it just helps those two bones sort of sit smoothly, within the joint. So as we've said, you've got two menisci. You've got a medial, which is on the inner part of the knee, and you've got a lateral, which is on the outer edge of the knee. And they change position slightly when the knee moves. And if too much weight is placed on a partially flexed knee, the meniscus can get caught between the tibia, that big bone of the lower leg, and the femur, which is your thigh bone. And this is where it can cause a tear. Now, given that the menisci, they only have a blood supply on their outer edges. So if they tear, particularly around that inner edge, healing can take quite some time, which is why I see so many people with this issue having, more longer term problems. Meniscus tears are a common sports injury, really due to the knee having to support a lot of weight during things like jumping, running, and supporting heavy weights at the gym. So treatment and recovery really will depend upon the severity of the tear, the location of the tear, and how old and how active the person is. So now there are different types of tear. So firstly, if we take a look at the meniscus within the knee. So again, you've got your knee joint here, the kneecap, thigh bone, lower leg bones. You've got all these ligaments there, keeping that kneecap in place. And these white discs here are your two menisci. So if we do a cross section, you can see these white discs of cartilage here. Now on this diagram, it's actually showing tears. So in a normal healthy meniscus, you wouldn't have this kind of hollow piece in the middle. It would just come round, and then on this side. And so this is the kneecap here. So you'll see a slight difference in the shape between the medial and the lateral. The medial meniscus on the inside of the knee forms a sort of a C shape, while the lateral meniscus on the outer edge forms more of a U shape. Slight difference there. And so the pain when you get a meniscal tear, it will affect the inner or outer knee dependent on which meniscus is torn. So as I just mentioned, there are actually 6 types of meniscal tear. So I'm just going to talk a little bit about those now, just so you can kind of get a visual representation. So first we have what's known as an incomplete tear, which is this one. So this is kind of completely contained within the meniscus disc. Then you've got a radial tear, which obviously comes in from the edge of that meniscus, but doesn't go right the way through. Then you have a horizontal tear, which literally, as it says, kind of a bit like a incomplete tear, but it extends farther around the disc. Then we have the flap tear, which, as you can see, just kind of creates a bit of a flap of that cartilage, which is going to be really prone to, obviously getting pinched when the joint moves. We've got the complex tear, which is quite, much more severe tear. So that one's going to cause quite a lot of pain. And then we've got the bucket handle tear, which again is a very extensive tear, affecting, covering a lot of that meniscus. So obviously symptoms and pain levels and treatments, will vary not only according to whether it's the medial or lateral meniscus, but also according to which type of, meniscal tear you actually have. Obviously, some people, are going to be more at risk of getting a meniscal tear. So anyone with arthritis, and this is really due to stiffness in the joints combined with, sort of a bit more wear and tear than your average person. Any older athletes, because we know with age, you get tissue degeneration, and obviously that means also, the meniscus is also going to weaken, which obviously puts it at more risk of injury. Any sports where you are putting weight through a partially flexed knee, or where you've got sudden turns and stops. So something like football, basketball, tennis. These are the sort of athletes that are going to be prone to a meniscal tear. And also children. It's increasingly common in children due to, nowadays children are participating in sports much earlier. And so there's, more pressure on those joints when they're still, their bones and everything and tissues are still developing. So those are really the main people that will be at risk of a meniscal tear. Okay, so in terms of causes for meniscal tears, we've mentioned that sports like football, basketball, tennis, that have sudden stops and starts, or anything that may be putting weight through a partially flexed knee, or involves a lot of jumping and twisting of the knee, those people are going to be at risk. But certainly anything where you fall or land too hard on the knee, where there's obviously an increased impact. As we said, any aggressive twisting or pivoting of the knee, which when you've got those sudden stops and starts, is quite likely. If you receive, so we're thinking sort of like contact, and then certainly again football, a blow to the side of the knee, this can actually result in a torn anterior cruciate ligament which runs down the front of the knee, or the medial collateral ligament, and also the menisci. And as we said, this is really common, in football, if you've got someone coming in for a tackle, and, if they catch your knee, then, that's quite a possibility that, you're going to have one of those injuries. Mobility of the medial meniscus means that this is more likely to tear than the lateral meniscus. And this is because of its attachment to the tibia, which is the large lower leg bone, and its need to be mobile. It just makes it a little bit less sort of stable. Ligament strains, we mentioned there about anterior and medial cruciate ligament tears in football, for example. Ligament strains tend to occur with twisting of the knee, and so they're often, also linked to meniscus tears, because meniscus tears also, if you twist the knee, that's, where damage can happen. Any activities, as we've said, that put pressure on the knee joint. So this also includes things, in the gym, like heavy weight lifting, and, certainly things like, maybe if you're lifting heavy weights in a squat position where you are, again, have that knee partially flexed, that could sort of contribute, or, poor technique, so that's what, it's always important if you're starting out in the gym, as I've said previously, to, ensure that you know how to use the machines and things like a leg press, and, to avoid injury. And also, we mentioned a little bit briefly there about squats. If you come up too quickly from a squat position, this can also contribute to injury to those menisci. So, in terms of symptoms, now going to talk about those. So really severe pain, obviously, and this will be particularly when you try to straighten the leg. or just when touched. And so, the pain obviously, depending on whether it's the medial or lateral meniscus, it could be more towards the inner or towards the outer knee. You may well get an initial popping sound around your knee joint at the time of injury, and anyone who has ruptured their ACL will know this sound very well. There may be mild to severe swelling of the knee, and this is due to accumulation of fluid and obviously, inflammation just due to the injury. Reduced range of motion and stiffness, difficulty walking. You may also find, and this again is very similar to an ACL injury, you may find that sometimes when you're walking, the knee will just suddenly collapse. Or you may just get a feeling of the knee might, give way. You may also get a clicking of the knee when it's at about 30 degrees before full extension. So, as you're sort of standing up from a, sitting position or squats. You may also get a periodic, almost like a sticking of the knee when it's in a bent position. And you may find that, you can't sort of sit in one position for too long. This really is just because the cartilage can kind of fold and block normal movement of that knee joint. Pain and swelling you may find that it subsides temporarily if you sort of jiggle the knee, and this can be that if the cartilage has folded, just that jiggling of the knee may just be enough to return that fold of cartilage back to its normal position, hence sort of temporarily resolving the problem. If the knee locks in a straightened position and bending the knee, may not be possible, in this case you really need to seek, medical attention, because there are actually some complications that can happen with these meniscal tears, so it's important to be aware of those. So these complications will be things like premature arthritis and wear and tear of the joint, irregular, cartilage edges, or, as we say, you can get fold in the cartilage. These things can cause locking of the knee. Part of the meniscus may come loose and become trapped in the joint, which again is going to really affect the range of motion in your knee. Tears can, it may start out as one type of tear, but the tears can increase in size if you don't, seek appropriate treatment, or, if you just kind of try to carry on and push yourself through at the gym, you can really make this injury a lot worse. And then also following, I'm going to talk a little bit about surgery for meniscal tears. Following a total or partial meniscectomy, there may be complications. The meniscus may be removed in severe cases due to lack of blood supply, affecting healing, and maybe, conservative treatment options don't work. So then, you may be looking at surgery, or, if you're sort of someone who's particularly active, or maybe a competitive athlete, you may sort of, that may warrant surgery, to get you back to your normal, level of activity. The problem with this type of surgery is that it can actually have an impact on the stability of the knee. And certainly, I know from being a surgical nurse that, the shoulder and knee joints are probably the two most complex joints. And with regards to surgery, it's not always the same afterwards. Once you've had surgery on these joints, there will quite often be some weakness there afterwards. And certainly, with removal of the meniscus, this can happen and the knee can become less stable. Okay, so I'm going to talk a little bit about the treatment now. As I've said, treatment and recovery time will vary according to the type of tear, the location of the tear, age, activity level, symptoms, etc. A small tear on the outer edge can heal with minimal treatment due to there being a blood supply in the area. But a tear on the inner edge of the meniscus doesn't have such a good blood supply. So often you'll find tears on the inner edge will require surgery, to fix them. But certainly, the standard sports therapy treatment, your RICE, so rest, ice, compression, elevation, will help to reduce swelling and control the pain. Certainly wearing an elastic compression bandage or a knee brace or using crutches to limit weight bearing, swelling and also movement, these things may be advised. Anti-inflammatories, obviously be careful of things like ibuprofen because they're gastric irritants and asthmatics shouldn't take them. Avoid obviously any activity or weight bearing that makes the pain worse. This is not a time to just push through it and carry on. Electrical stimulation may be used to strengthen the meniscus and the surrounding tissues, or corticosteroid injections, which will basically help relieve pain and inflammation, but the effects are temporary. So this is not a long-term solution and the meniscus may still require surgery. Another injection that you may be able to get is PRP or platelet rich plasma. And these injections at the site of the tear, what it does is it releases growth factors which stimulate healing. Certainly massage to reduce swelling and stiffness, which I'm going to talk about, and physiotherapy obviously to restore functionality and strength, and improve stability in the joint. Physiotherapy may be part of a conservative treatment plan, or it can be used both in preparation for and recovery from surgery. Exercises helping to strengthen and stretch the muscles around the knee to avoid any overcompensatory imbalances. And obviously sometimes it can be a bit of a wait for surgery, so then your whole posture changes to compensate for that weakness in the knee. Okay, now in terms of surgery, So it is usually arthroscopic surgical treatment. So using a camera. It's not like the whole knee isn't opened up. Doctors may wait for around 6 weeks to see if the swelling and pain improve before treating surgically. And in terms of the surgery itself, this could involve a medial or lateral meniscectomy, which is removal of that meniscus. It can be partial or total meniscectomy. So it may be a case of just removing the piece that is torn, or it may be that the whole meniscus needs to be removed, and obviously that will depend on the extent and the type of tear. Now, with meniscus repair, if the tear is in the outer sort of red zone, which has a good blood supply, you're looking at probably around a 6-week recovery. Obviously everyone's different, but that's just an approximate sort of time. But obviously if it's in that inner zone, there's less blood supply, so recovery is going to be longer. Surgery is much more likely if that knee keeps locking. That's really, the best option then. Now, in terms of rehabilitation and exercises and massage, recovery can really take anything from 3 weeks for a very small tear, to maybe 3 months, depending on, as we said, the type of tear. Pivoting, twisting, squatting movements really need to be avoided until that joint is stable again, and you've strengthened the surrounding tissues. Exercises to improve range of motion start usually within a few days of surgery, and it is really important after any joint surgery to get moving early on, but not to overdo it. Exercises to maintain the strength of those quad muscles on the front of your thigh, which will cross the knee. These will help to improve knee stability. Now, initially, it could be something like doing straight leg raises or just mini squats, which only bends the knee to around 15 degrees. And obviously, crutches just to help with walking, assist, so you're sort of only partially weight bearing until everything is healed. In terms of prevention, performing exercises regularly that strengthen the leg muscles and help stabilise that knee joint, using protective sports equipment or a brace to support the knee during activities that may increase your risk of injury. So, for example, if you're someone who's down the gym every day and you're doing deadlifts, you may just want to wear a knee support just to, give that extra little bit of, stability. And obviously making sure that you're using correct technique when doing exercises that may be putting the knee under pressure. Always warm up and stretch before exercising, and also just do some stretches afterwards to cool down, and wear shoes that are designed for the activity that you're doing, that support the feet well, so that you're not putting the rest of the leg out of alignment, which again is going to improve your chance of getting injured. So in terms of exercises you can do for the recovery period, probably one of the first, things to do is look at flexion and extension. So bending and straightening of the knee as far as pain and range of motion will allow. Initially, this is going to be about 15 degrees of flexion, so not very much at all. And then you would really just build it up slowly, as I say, as the pain allows. You can also do straight leg raises, so lying on your back with your good leg, with the knee bent up, while keeping the sort of injured leg straight. And you're going to slowly lift the leg about 6 inches off the floor. In the process, you'll be tightening those quad muscles at the front of the thigh, which cross the knee and are responsible for knee flexion. And obviously, you can gradually, as you get stronger, you can gradually lift the leg higher. The next exercise you can do are heel slides. So again, lying on your back, slide the heel of your injured leg slowly along the ground, moving your foot as near as possible to your buttocks. Again, only go as far as pain and range of motion allow. The degree of flexion to start with will be minimal. Again, probably about 15 degrees, and you can slowly build it up, over the recovery period. We've talked about tight muscles, affecting the knee. So another thing you can do is calf raises, where you stand with your feet shoulder width apart, and then you're going to lift the foot up behind you as high as you can off the floor, and slowly back down. Again, only so far as pain allows. And the degree of flexion again to start with will be minimal, but you can gradually increase it as you get stronger. And then the last exercise to do is hip abduction, where you will stand on the good leg and raise the injured leg out to the side, away from the body, and that will just help, with sort of the quads and just again just to stabilise that knee. In terms of returning to exercise, make sure that you take time to recover and slowly progress and gain back your strength. Start with those basic exercises that I've just gone through before progressing onto more advanced exercises. So things like weights with deeper squats, And again, when you go to start doing that, start with light weights, and gradually, increase the weight, gradually make the squats, deeper to work the legs harder. And if at any point it's causing you pain, just stop doing the exercises, take a step back and just slow it down a little bit. So now in terms of massage for meniscal tears, there are a variety of techniques that can be used, with sufficient pressure to reach the underlying tissues and structures of the knee, through the superficial tissue. Myofascial massage may be particularly beneficial, which is sort of involved in your sports massage. and this will help to increase the blood flow, which of course brings oxygen and nutrients to the tissues, promotes healing, reduces inflammation and reduces pain levels, which obviously will help you feel more able to do those exercises. It will also in the process reduce muscle spasms and just help with that recovery process, promoting normal tissue repair, and also it will help to break down any scar tissue and adhesions that may be forming after surgery or even just after, the injury itself. And it can do this by using deep frictions across the tissue, as deeply as possible. Now, certainly the first time you go for a massage, sort of, in this recovery period, this may be painful. So, again, communicate with your therapist if anything hurts, and only, proceed as much as the pain will allow. Massage will also, by doing all of these things that we've talked about, help to restore normal range of motion, and just help to strengthen the surrounding muscles and stabilise that knee joint, as a result. Which means that, you can then go on and get back to the level of activity that you're, used to. So that's really it for meniscal tears. Any questions, feel free to comment down below, or you can contact me on my Facebook or Instagram. I'm on there as the medical massage lady, and I will answer your questions as soon as possible. But for now, that's really it from me. So take care, and I'll see you next time.